I can introduce our next speaker, that is the Professor Jan Kremer, who is a biologist with an intensive background in the system of neurobiology, electrophysiology, ophthalmology, and psychophysics. In 2006, he received a fellow in the Stellan program of the RT Foundation, and currently he is working as a professor in experimental ophthalmology in the Department of Ophthalmology at the University of Erlangen. Since 2006, he is also a recipient of an honorary visiting professor of visual neuroscience at the School of Life Sciences in the University of Bradford in United Kingdom, and his current research focuses on the electrophysiological measurements and ophthalmological examination in monkeys and rabbits. So, Jan, the floor is yours, and thank you.
Yes, thank you very much. Can you all hear me and see my slides?
Yes. Yeah, perfectly fine.
Okay, thank you. Thank you once more for inviting me to talk to you. I wanted to show you some results from our own lab, mainly about electrophysiological readouts of retinal integrity, and mainly in the mouse. But I would want to also include other mammals. And the purpose of my presentation is to show ERG measurements in the mouse. And I want to show you also how they can be used to detect alterations when there is a disease, for instance, and also maybe how they can detect improvement after a therapeutic intervention. So this is basically the extension of the last sentence of the last slide of the previous speaker, where this was a challenge. And ERGs, maybe not everybody knows, but ERGs are non-invasive electrophysiological measurements of the function of the retina. I want to describe today novel stimulus techniques because until now, mainly standard stimulus techniques are used to describe the function of the retina, and I would show you some new techniques. And I would also want to show you how these techniques can be used to translate data from mouse to humans, and maybe also to other speakers. I have to excuse myself if I'm going to be too technical, and maybe not everybody can understand everything. But I'm also, as an electrophysiologist, quite often bombarded by terms, techniques, and theories from other fields, which I have to work myself into. So please excuse me myself when this is going to be a bit too technical for some of you, but I was not aware of who's going to be the audience. The ERG is a technique where you put an electrode on the eye. You can do that with different species, as with humans, for instance. You can use contact lenses which have a gold ring. You have gold foils which you can hang more or less on the eyelid. You can have skin electrodes. You can also, these are mainly used nowadays, small fiber electrodes which are put on the eye, and then the subject puts his or her kin on here, and the forehead is on here, and then you have a stimulator which gives visual stimuli to the subject, and with these electrodes you can then measure the activity, the mass activity of the retina to these stimuli. And nowadays, and that's what I wanted to point out today, nowadays mainly flashes are used either in dark or light adapted conditions, but I would want also to show you today that there are other techniques available. With mice, you do something similar. The mice never do this voluntarily, of course, so they are anesthetized and they're put on a table which is heated so that the temperature of the animals are kept normal, so that they don't freeze more or less. And then you have we use small contact lens electrodes which are put on the eye, and they also have these gold rings with which you can measure then the activity of the eye. You have reference electrodes, just like with human subjects. They also have reference electrodes at the ipsilateral side of the eye. So here both eyes are measured simultaneously, and you have a ground electrode which is positioned subcutaneously at the base of the tail. And then the animal with the table is slid into the same stimulator as been used with human subjects. And I wanted to show you today three examples of stimuli that can be used. And in the beginning, I wanted to show you with standard flashes, standard EEG measurements, which are used normally and in most of the time. So where this stimulator produces flashes, normally white light flashes, or either on a dark adapted background or a light adapting background, so that the animals are either dark adapted, so or they are light adapted. And I wanted to show you today one example of measurements done in a mouse with the CAGNA1F mutation. And the CAGNA1F is a subunit in a voltage-gated calcium channel, which is in the presynaptic side of the synapse between photoreceptors and bipolar cells. And this is a mouse model for congenital stationary night blindness, because the transmission between photoreceptors and bipolar cells is disturbed. And what I understand from the program is that this afternoon, Christina Zeiss is going to tell something about congenital stationary night blindness and possible cures for it. This mutation, it was a point mutation, was found previously in subjects in patients of a family in New Zealand, and this mutation was a point mutation in the gene, and this was introduced into the mouse. And we also had another mouse in which there was a deletion in that particular gene, and that deletion resulted into a loss of function, whereas this point mutation resulted in a gain of function in that particular calcium channel. Now here you can see the responses in a wild type animal on the left side for different flash intensities, and you can see particularly at higher flash intensities, or that there is some sort of negative deflection called the E wave, which is showing the function of the photoreceptors, and then a later B wave, which is showing basically the activity of center bipolar cells. And on the ongoing flank of the B wave, you can see quick or oscillatory potentials, which probably originate in the amacrine cells. And here you can see measurements we did at age 1 and 8 months in these animals. One of the advantages, once more, in these EEGs is that they are non-invasive, so the animals can wake up and they can be measured more often, and therefore inter-individual variability can be ruled out. On the right, you can see these are dark adapted scotopic flashes. So the animals are dark adapted, and then a white flash is given. And on the right, you can see the two in red, the gain of function, and in blue, the loss of function mutations. And basically, you can see that there is an A wave available, showing that the photoreceptors themselves may be functioning, but there is loss of B wave. And that shows that the transmission from the photoreceptors to the bipolar cells is is lost, more or less, is not functioning well. What you also can see, what we saw with structural investigations, is that the animals, when they get older, that the retina of these mouse models degenerate, and particularly in those animals with the gain of functions. And that is something which was also observed in this this New Zealand family, where there were progressive degenerations found. Here on the right, you can see the responses to photopic, so light-adapted flashes. So the animal is seeing a white background, and on top of that, white flashes are given. And here, basically, the mutations didn't give a response at all. So this was a very severe phenotype electrophysiologically. And just to show you that this is was also found in this New Zealand family, that you can see in a normal, in dark adapted state, in a normal human subject, there is a strong B wave, which is basically gone in one of the male members of this family, and also in the lighter and in the bright flashes in the dark adapted state, there was a strong A wave, and also a strong B wave, normal subject, whereas in this patient you can see that there is a A wave but hardly any B wave, so similar to the mouse model. Now, as I said, basically we are using standard flashes, but we can also use other waveforms like sawtooth or sinusoidal modulations. And this is shown now in a Duchenne muscular dystrophy mouse model. And Mirella Barboni and Cyril Vaillant are going to tell you probably also this afternoon about these mouse models. And you can see also that these, in one of the mouse models, the MDX52, there is also some loss in function in the flash ERG. But we also can give sawtooth, in which we give either a rapid on, so sudden on going of the light and then a tapering off of the light, or a rapid off where the light is suddenly switched off and then slowly goes on again. And then you can see you can measure the responses of different pathways within the retina. And also there are changes. I'm going to still skip this slide because I wanted to show you a bit about another technique, because the disadvantages of what we've done until now is that we have used the dark adapted state or the light adapted state, but we don't know whether we bring the whole retina in the different state of adaptation by adapting them. So the disadvantages is if we find a change in the dark adapted state, we normally conclude, or we can conclude, that the rods are not functioning well, but that might be wrong, because it might be also because the retina is in a dark adapted state of adaptation. So we cannot disentangle that, and we cannot influence the state of adaptation directly, and that cannot be studied on. The disadvantage is also that we cannot use we can only use flashes, and we also wanted to use other stimuli. What we also we cannot quantify the stimulus strength. And in phase of the time, I will not explain everything which we did, but what we what we try is also to use color into the stimuli, and we can then, for instance, change between two wavelengths, two different colors, and if you take into account the numbers of photoisomerizations, the numbers of photons that are absorbed, then they depend on the absorption spectra of the pigments and on the intensity. And if we have one particular photopigment, then we can take into account the absorption spectra and compensate the differences in absorption by increasing or decreasing the intensity of the light, so that one of the photoreceptors always absorbs the same number of photons. So in this case, about, say, 6 or 8 photoisomerizations per second. If the other photoreceptor has a different absorption spectrum, then there will be also a change in numbers of photoisomerizations. So in this case, by using this technique, we can isolate the responses of this particular photoreceptor type. And furthermore, we can then quantify also the stimulus strength of in that particular photoreceptors, because in this case it changes between 12 and say about 2 photoisomerizations per second. We can use this technique in different animal types, and I will skip this all. I wanted to show you just this. We did do this, for instance, with monkeys and humans. Here on the left side, the responses in humans and in monkeys for different frequencies. You can see that there are different, very similar response characteristics. So if you isolate the long sensitive cones and the middle wavelength sensitive cones, there are give about similar amplitudes at low frequencies, but higher frequency, higher responses for L-cone isolating stimuli than for M-cone isolating stimuli in humans and in macaques. So you can translate the data, you can compare different species with each other. I will not go into this because there is, in the mouse, you can do that as well, but there's one problem in the mouse. The absorption spectra of rods and M-cones are very similar, but there are ways to go around it by using different mouse types where the M-cone, the native M-cone is replaced by a human L-cone, and then you can use that technique again. I will skip this slide as well. This basically shows that you can do it at different luminances for rod and cone isolating stimuli, and at low luminances, so little light, the rods are responding well, and at high luminances, so high light levels, the rods are responding not that well, but then the cones are responding quite well. So you can use that technique now also in mice, and we can, as I said, we can also quantify the responses, and thereby you can then quantify also, you can compare the responses in different species. And we did do that in humans, in mice, and also we included dogs. And we can see that the responses with rods are very similar if you have the responses as a function of temporal frequency again. For the S-cones, again, they are similar in mice and humans. Rods and dogs might be a bit have lower response at high temporal frequencies. For the L and the M cones, you can see that dogs and humans are doing quite the similar thing, so with a maximum at high temporal frequency. Mice are quite different though. So here the mice are the oddballs, and that is, but their LM cones are doing quite the same what their S cones are doing. So we can conclude something also about how signals are processed in the retina. And so we can use these data as well to translate functional conclusions from one species, we can use that to translate also to other species. This is just to show you, I just wanted to show you today a bit of an overview of how the EEG can be used to detect and describe alterations in the function of the mouse retina, and maybe also the consequences of therapeutic interventions. I didn't show anything about therapeutic interventions today, but I'm pretty sure that Cyril might show you something about EEGs in DP71 knockout mice for Duchenne muscular dystrophy, and how we can also use other stimuli, saw teeth and sinusoidal modulation to characterize post-receptoral mechanisms, and that we are using also now other type of stimuli that might be also ecologically more relevant for the animals. We can use also color to separate stimuli driven by different photoreceptor types, and that is independent of beam luminance, chromaticity, and temporal frequency, and of the state of adaptation. And that can be used that they can be studied then independently, and that they can be used also to compare the results between different species. I would want to stop here, thank my group. This was in Corona times, and this is a few minutes later, but it's hopefully permanently now. This is Avinash, who did do human recordings and also did the recordings with me with the monkeys. Annika and Nina are doing mouse recordings. Julien and Cord basically doing psychophysics in human subjects and patients, and we have also support from technical support from Edith and Sarah. And of course, there are different external collaborations I would want to thank. I will not mention them all, and I would want to thank you as an audience for your attention. Thank you very much.
Thank you, Jan, for the nice presentation. You have already one question for the chat, and I think that we can answer it. So,
yes.
Do you know why the beware under photopic conditioning might we complete the CSMB is absent under photopic condition, and which is not the case in patient?
Why the B wave under photopic conditions in mice is absent under photopic conditions, which is not the case in patients? I'm not sure. It's a good question. I do think that again, I do think that in this particular case, it was a quite severe disease. I do think that CSMB might not be the right, might not just affect the rod system, but might also affect the cone system, because in this particular case, voltage-gated calcium channels are also found in the cone pedicles. In this particular case, I do think that also the patients were affected. I'm not sure how that is in other patients, but if you have incomplete CSMB, it's quite often also post-synaptically, and that might be a difference than between rod and cone channels. I'm not sure, but maybe Christina might be able to say more about it even.
Thank you.